Good morning, good evening, everyone. Today we have our students, and I'll introduce them, or they'll introduce in a minute, but the focus is on US clinical experience, the importance of USCE for match, what skills you need, and how that can lead to more networking and the eventual match. So let me take this opportunity and have our students here who have had a successful match. A lot of which has to do with the USC. So why don't we bring them on? So Tejasvi, do you want to start first?
Sure. Hi, Pavan. So hello, everyone. My name is Tejasvi. I graduated medical school from India, and I'm an old grad. I graduated in 2011, and I wanted to come to US for my further studies for pursuing residency while I was in med school, but life had different plans for me, and there was a break in the whole process. But I took my steps during the process, and I did not have very good scores. My step one was low; it was 208, and I also had an attempt in CK. But and which is when I reached to Sarthi, and they were like, because step one is low and there's an attempt, when you take on step two now, you should have real improvement to show that that was not what was defining you. So my step two CK on the second attempt was 230. So that, I think, was because it was 30 points more than my step one. So program saw that as an improvement, and it gave me a scope, like, to mention that I had improved and there were issues during the step one and that did not define me as a person. And obviously, and then I have been applying. This is my third season going in, actually, and now I matched.
Well, congratulations.
Thank you.
So Luchi, let's go to you, and why don't you introduce?
Okay. Hi, everyone. Thank you for this opportunity. And my name is Luchi. I tell people it's Luchi like Gucci. And I also am an old grad, and this is my second cycle. And oh, what else? Well, the journey has been crazy. I didn't even know that I was going to be in the US to start with, but when I got married, my husband was here, so I had to quit my job in Nigeria and I moved over. But then staying here, I saw opportunities to be even a better physician and to improve myself. And even if in the long run, I have to give back to my country, I can learn some things from here. So that's when I decided to start my USMLE journey, which wasn't really a good idea because that kind of created a gap. But at the same time, it's something I couldn't help because of that. So I really worked hard. But one thing I did was, okay, since I'm going to family medicine, let me just try out every specialty, since family medicine is jack of all trade and all that. But joining Sarthi kind of gave me a different perspective. Yes, family medicine might have a little bit of everything, but your profile, your CV, everything has to be tailored to that specialty. You can't be double dating. That's what I call it. So if you're dating family medicine, make it exclusive. So, and I joined Sarthi late in my first cycle. By then, I mean, Sarthi cannot wave a magic wand, to be fair on them, because some people come with a lot of baggage and everything, and you are expecting Sarthi to just wave the wand and everything comes. All they do is to yes, this is the ingredients that you have. So they'll say, okay, this is a recipe. This is how to make the meal you want. But it's with what you have. That's what you use to create that. If you want to make it extra spicy or sweeter, yes, you can take their recommendation, but the job is on you to do that. So that's first and foremost. When I joined late, I'm like, okay, they should be able to do everything for me. I paid this amount of money, blah, 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 blah. Yes, it's not about the money and all. You also have to put the work. So that was what I learned from the first cycle, and I had to take responsibility. And then the next cycle, I actually started January, even before I saw my March results, and started looking for rotation. Even I spoke to Power One and all, and that's how they helped me actually become specialty specific. And I started from there, and now here I am. Yes, like Teja said, I had a low score, I had attempts, old grad, almost all the red flags in the world and all that. But I know I prayed like it depended on prayer, and I worked hard like it depended on that. And I matched. So thank you.
Congratulations to you too. Now, the focus for today is US clinical experience, and both of you have had extensive hands-on experience. So that's what we want to kind of discuss today. So, Tejasvi, let me start with you and ask you the skills you gained from various US clinical experiences, and especially in your current experience with Dr. Saad.
Sure. So let me first start with saying that I matched in general surgery. So it's totally different from where I was doing my rotations. Dr. Saad's clinic is an internal medicine clinic, but you can make out of whatever you get into whatever you want into. So I always mentioned to Dr. Saad that I wanted to be a surgeon. So his is also an urgent care. So accordingly, he allowed me to assist on minor procedures like maybe an incision, like a suturing or a draining of an abscess or PRP procedures. He tailored it to my interest in career, and he used to like help me assist in that. And there was also a great amount of hands-on experience with patient care. So last season, when I interviewed with the same program, the most important thing they were impressed with is that I was very much familiar with the EMR system. But it was only 3 months since I had joined Dr. Saad at that time. So the APD who interviewed me, she told to me that you should continue doing what you're doing. You should be involved in patient care, gain as much hands-on experience as you can, because I think that's what the programs are mostly looking for. Because yeah, they will train you, you will be PGY1, but they don't want you to spoon feed everything to you. They want someone who is ready to, like Pawan always says, hit the ground running. So they want someone who is already like has some in their basket, and then they would take them and train. So I think they are looking for that hands-on experience. And Dr. Saad allows you to access the EMR, and you get to talk to patients, take patient histories, examine them, physical examination and all that. So I think all that added on to the hands-on experience which the programs are looking for. So I think that's one very important thing there.
Okay, so Luchi, so the EMR experience, patient management, what else do you think you picked up as part of your USCE?
Okay, yes, with Dr. Saad, which I actually got to know through you and the word that you put in for me, it was more like how did they say that? One-stop shop kind of thing. Like I got the clinical experience, I got like a feel of how the healthcare system works, the EMR, and the icing on the cake is I also got my first time of being a part of clinical trial, like research, because there was one that they were doing. I happened to be one of the assistant clinical research coordinator. So that kind of exposed me to like, wow, is this how the clinical trials happen? And it was fun. It was like a good experience. And then with the COVID too, I also learned how to do like the COVID swabbing, and a senior intern stager and we kind of run the COVID clinic. So like Dr. Saad kind of gave us that sense of responsibility. Like, yes, you can do this. You're already a doctor. Yes, you're not a doctor here. You're not practicing yet, but you are. So he kind of encouraged us to be the best. We can be the best that we are, that we did not match, does not define us. So he did his best to give us the exposure that we needed. So it's like you're getting your research experience, you're getting your clinical experience, the EMR, and even how to do like teamwork, even with a lot of patient load. How can you do this? Because it's also a fast-paced, and I call it like a pre-residency experience, because you got kind of have a foretaste of what you might see, and I appreciate that.
Okay, let's continue on the same vein, Luchi. So when it came to the interviews, what kind of questions or themes did the programs have for you around the US clinical experience? What were they looking for?
Okay, yeah, actually the program that I matched at right now was kind of funny, because we all learn about tell me about yourself. So I was ready, my gun loaded, everything to answer that. But they didn't even ask the question that way, especially when it came to also merging it with my specialty, family medicine. I was like, okay, is family medicine really your first choice? I'm like, yes, it is. And you're like, okay, what in your background or history suggests that? I'm like, man, I've already crammed, memorized what I have. So now I have to cut and join and pick the things that actually align to that. And genuinely, yes, family medicine is what I wanted. So I went back, tell me about myself kind of thing, but I had to revise it there and then. So what I'm driving at is, yes, you might cram and have a script, but still make it part of you. Let it be true to you, so that no matter how they ask the question in between, from the beginning or from the end, you were able to deliver. So from there, I just went to all my volunteer experience, my missions. And even though I'm still doing a senior intern job with the primary care, at the end, I want to focus more on primary care at the end of my training. So it's not really like out of line, me working with Dr. Sad. That actually reinforced that for me. I was able to know how to integrate to the community that I am in. So I kind of brought all those things together. So they also want to see, okay, yes, not just internal medicine, family medicine. What in your history, what about you will show us that, yes, you're committed to this. So you can always like wind it together and put them together. And also to ask the question like an old graduate, okay, you might work with people that are way younger than you, that are fresh graduates. How will you cope? Are you sure you'll be able to handle this? I'm like, I'm a lifelong learner. Even if it's my daughter that I'm learning from or whoever, everybody has something to teach you. So just be open-minded. So the coordinator was like, we need you in our program. I'm like, thank you. But genuinely, yes, because that's how we learn. Right. Nobody knows it all.
So Tejasvi, in terms of the US clinical experience and skills, what do you think the programs were looking for, and how did the interviews go surrounding USCE?
So what I noticed was a lot of people are coming to the US for US clinical experience these days. Nobody is going into the match without having a US clinical experience. I mean, it has become a compulsory thing now. So everybody is having it. So what is it that which makes you stand out from is what you are doing to create opportunities for yourself to learn. For example, when I visit Dr. Saad's clinic, I learned how to do an EKG. I learned how to do small procedures like giving injections or drawing blood, or and also when I had time, I went back, and there are so many videos and so many online courses where you can learn. I learned how to do POCUS, cardiac ultrasound. So those are the opportunities I created for my own self. Anybody will come into do a rotation. You will be given patients. You will be given EMR based on where you are rotating, and that's common for everything. But what is the extra that you're doing, which shows that you are interested in it? You're creating opportunities for yourself. I also saw some students who were coming in at Dr. Saad's, and they were like, Dr. Saad, I have this interesting case. I would want to try and publish it in some journal. Would you help me? And Dr. Saad is very much open to such things. If you come up to him with such ideas. We also had one student who published it. So I think the programs are particularly looking for that, what you are making out of the US clinical experience, rather than just coming and seeing patients, which is given to you. So I think that extra mile which you go is what makes the difference.
True.
Okay. So, as applicants who are going into the season, if you were to summarize or tell them the top maybe 3 to 5 skills when it comes to USCE, what would those skills be? So Tejasvi, maybe you can start. So I know we went over a lot of things like the EMR access, patient management. What are these, if you were to just give them a cheat sheet that, okay, go to USCE and look for these skills?
So like I said, your only goal should not be getting an LOR. That's not the only goal that everyone gets. So other than that, what you want to do is try and see if you can get any publications, for example. Research is always not the only way to get publication. You can always get it from a USCE too. They're all doctors in experience who have had publications, so they know how. So make use of that. Try, if you have an interesting case or if you're working on some review, ask them to mentor you. So they will always be willing to do that. So that is something you want to get out of it. Learning EMR definitely is one thing, because that is something which a program will have to put effort into, teach you the EMR when they take you. So if you learn it beforehand, that'll always be a positive point on your application. So that's one more thing. And always try to have get as much hands-on as possible. I know everywhere it's not possible. Some things are only observerships or tele-rotations, but as much as you can, be proactive. Ask the mentor that you want to present a case, or you want to take the history. So if you ask, they will give you opportunities. So I think those are the three things that you would want to look for.
Okay. And Luchi, in your experience, what would be your top 3 or 4 recommendations to the applicants in the upcoming season? What should they focus on for USCE?
Yes, and I agree with everything that he just said. So first of all, I'll tell them, take a breather, especially if it's going to be your second cycle. Take a breather, relax, ask yourself, why am I even a doctor? Why this specialty? Then think about your goal. What do you want to achieve? And with that, you plan your USCE. You look for opportunities that are actually in line with your goal. Like even with Dr. Sad, there were other opportunities I saw, but they were not in line with my goal. I had to pass up on them. Yeah, they are good opportunities, but they are not like better or best for me at that time. So if whatever you look for, you will find and all that. So what I would say is first, like if you're going to a fast food, there is pie, there is chocolate, there is ice cream and all that. You can't eat everything. They all look delicious and nice. You can't eat everything, but you have to tailor it. Okay, am I diabetic? Do I want a healthy meal? What do I want? That would actually determine, because our finances are limited too. That would determine what you're going to buy and what you're going to eat. That would help you. So the same thing with USCE. There are so many of them out there, but they are not all for you. So what do you want? So even when you get that opportunity, look for what will reinforce your goal, your values, because they'll ask you about your values too. And all that, which I know that they ask me so much. And like with Dr. Sad, hard work is something that he values, being proactive, which I believe everybody, because for me, I'm like, okay, I have to work like it's also my own thing.
Mm-hmm.
I want somebody, my employee, to work for me when I become a boss. And also that's how I applied and put in my best. Okay, this is hard work, even if he's not watching, if nobody is watching, how am I going to work? So be genuine, be true. Don't do eye service, because I tell you, somehow somebody notices, even if it's not him, even if it's not the attendant, but you're doing it for yourself, because one day you are going to go into residency, all eyes will be on you. You can't pretend like for 3 years or even in your practice, but it starts now. So even with your values and skills, all these things, make sure they're in line with your goal. So that's why I will actually say, because even research, I had to leave some research groups, like 3 of them, because they were not in line. Because I entered into them like I didn't have any research. Let me just keep doing research. But when I joined Sarthi and when I looked at my goal, I'm like, it's not really in line. I'll pass up on this. And I told them, sorry, I can't continue, genuinely, because it was too much for me. And so don't take up more than you can chew too, because they said get USMLE experience and you are going for everything. No, quality instead of quantity. And in that quality, make sure you put in your best, make sure you get the most out of it. Like Teja said, your EMR, and also skills that you can learn from that, not just LOR, because everybody gets LORs, but what is going to differentiate you from other students that are coming? So,
well, I guess thank you very much, both of you. This was very, very comprehensive and a very good guide to the applicants looking for some quality USCE, the skills that they should learn, and what the programs are looking for. So thank you both, and good luck in your residency journey.
Thank you.
Thank you.